Welcome to Knovva Academy. My name is Alex Crosser and I'm head of online learning. We're very excited to present the Pandemic and Public Health Initiative, designed to help teens around the world become better informed about one of the most impactful events of the modern era. The COVID-19 pandemic is an unprecedented challenge to our modern systems of healthcare, our economies, and our governments at every level, from local to global. Global challenges like this require global solutions, but is that enough to fight the pandemic in every neighborhood? How do the responsibilities of local systems differ from global ones? What are the challenges we're facing today, and what solutions must be developed? What kind of leadership will help us slow the spread of this pandemic and limit the damage it causes to our economic and public health? To help answer these questions and others, we're very fortunate to be joined today by Professor David King, a senior lecturer in public policy at the Harvard Kennedy School. Professor King, in a few words, could you introduce yourself to our students and describe a little bit of your background as it relates to our conversation today?
Well, I've been teaching about U.S. politics and the focus on state and local government. I run a program at Harvard for leaders on state and local government, but I also run Harvard's training program for newly elected members of the U.S. Congress. So I spend much of my time thinking about U.S. national politics, and then on a very practical level, helping to train governors, mayors, city councilors, so forth.
All right, sounds like we got a breadth of leadership covered. So to start with millions, if not billions of people around the world practicing social distancing, I feel it's important to talk about a little bit about what that experience is like. So if you could share, what are you doing to stay happy and healthy during social distancing?
Well, before many of us thought that this was a serious problem, in the second week in March, Harvard University shut down, but not simply shut down, they also kicked us all out of our offices, out of the facilities. If I were to try and go in to my office right now, I would be apprehended. No one is allowed in those buildings because they need the virus to disappear. And until it's really cleared through the population, people shouldn't be going into public spaces where they could spread it again. So everyone in my community has been practicing social distance, which is we just hang out in the house. We go out for walks, but our faces are covered with masks. We stay far away from our neighbors. It's an interesting time because we're actually seeing more of our neighbors today, although at a 6-foot distance than we did before the epidemic. So we'll get through this, but of course, it helps to be in a part of the country and a part of the world where we have some of the resources in which we can socially distance. There are huge swaths of the world where social distancing simply isn't an option. And that's going to be very difficult to tamp down this virus, to quell the pandemic, unless we can take care of people who right now have to be cheek to jowl with each other.
Why is leadership important during this crisis? And what are the qualities of the most helpful type of leadership?
Well, this is a crisis that is like a fire in a building. There's not a lot of time for sort of debate and cajoling about whether or not we need to put out the fire. So the type of leadership that is successful is one that engenders compliance among the citizens in order to socially distance and to be safe and wash their hands and take this seriously. Of course, we see huge differences across the world in whether or not a country is well positioned to enforce or to persuade people to be compliant. China was very effective in Wuhan early on because they could, from a position of strong leadership, say, stay inside. And that's helped the rest of the world. Maybe it could have happened sooner, who knows, but it has helped the rest of the world to understand that this is a massive problem that can respond to social distancing and containment. In the West, so most notoriously so far in Italy, there's a history of needing to persuade people rather than to command people. And the tools of persuasion in democratic systems have varied in their effectiveness across every country. So in the long run, even in the short run, people need to comply to turn this pandemic into something that is simply endemic as a virus. And the different political systems have responded quite differently. If you're a leader in a democratic system, look people in the eye, tell the truth, persuade them, help them understand that you're in it with them, but you can't command. And that's where a place like the United States has fallen short. We have not had a leader in President Trump who's been very effective at persuading people of the seriousness of the problem and the solutions to those problems. Where have we seen leadership in the United States? Well, it's actually coming from first big city mayors, and then second from governors. But even as we're talking today, there are a handful of governors that have refused to have stay-at-home orders for their states. So we're seeing a lot of variation among the political leaders in the United States as to who can persuade and whether or not people are willing to trust them.
Would you be able to say a little bit more about what the role a mayor might play versus what the role a governor might play, a local neighborhood leader versus a regional leader?
The way the US political system emerged was from very local governments, cities and then counties, up to states, and finally having a fairly robust and relatively strong federal government. So even today, mayors have tremendous authority that they would not have if you were a mayor, say, in most other democratic systems, because our history began at such a local level. So a mayor of a town now can close the schools, close local businesses. They can't shut down transportation. They can't shut down air flights into their space, things that will cross state boundaries, but local mayors have tremendous authority. A place local and state leaders can do a tremendous job, and they have the authority to act. But in the absence of national leadership, which we have not had effective national leadership in the United States, if those local and state leaders do not act, the people remain vulnerable. They don't contain, they don't take it seriously. We're watching an interesting experiment, but it's an experiment in which the outcome is death rate. And that's a pretty frightening experiment for a democracy to go through.
So earlier in our conversation, you referred to the crisis as a building on fire. And it seems to me that decisions not only need to be made quickly, but they need to be made very decisively to create a sense of trust and definitiveness to what the right course of action is. So when leaders are having to make such crucial decisions so quickly, how can they be sure they're making the right decisions?
Well, of course, at one level, you can never be completely certain that you're making the right decisions, which is why leaders need to surround themselves with people who have varying points of view, but where expertise is really the card that's most important in that deck around your table. And those governors and mayors that have surrounded themselves with public health experts in particular have done a very effective job. The places where they have refused to let public health officials have a place at their table or even listen to them when they were there is where you've had leaders do a very poor job. So a strong leader who is going to act decisively can't simply go on his or her gut. They have to put themselves in an environment in which they're surrounded by experts of varying points of view, and then you find the most reasonable path forward. If you have decisive and quick action, but it's aimed in the wrong direction, it's a disaster. And again, we're learning this in very real time.
What sorts of stresses does this crisis put on governments at different levels?
This is putting massive stress on our actual mechanics of government and our mechanics of serving and service and delivery. The most obvious example, of course, being hospital systems. In the United States, the hospital systems are not run from the federal government. Most of our hospitals are nonprofits or public hospitals. Very few are actually private hospitals. And there's not a lot of coordination that happens among them. So the stress on those systems is really quite dramatic. And how do they share resources? How do they share information? They don't even use, for example, common data sets to be able to cross information across from one hospital up to the federal government. But that's the obvious case. What's less obvious are the day-to-day mechanics of running a government, beginning with water and sewers and maintaining of clean water and processing of waste and handling parking tickets and normal day-to-day routines. All of that is shut down. Maintenance, local maintenance, road maintenance, and buildings have all been shut down. So there will be an interesting backlog for local, state, and federal governments as they try and bring all of this back online in, who knows, a few months.
Going back to the house on fire metaphor, I wonder how a global challenge like this differs from a more slow burning fire like climate change. How do the roles differ?
Well, if we think of the world community not as one building that happens to be on fire, but as a neighborhood of 200 homes, some quite large and impressive, and other homes much smaller and struggling. A fire in one of those homes can leap to the other fairly quickly, especially if you don't have a fire department that serves the entire neighborhood. And that's what we are in the midst of right now. You know, a very large and important building caught on fire, a home in China, which spread throughout parts of Asia and then to South Africa and to Europe and to the United States. Without us having a strong sort of fire department to coordinate services to put out that fire. And we're going to have a fairly significant loss because this moves quickly and it was time for a rapid response. Our borders don't matter to a virus. Just like a fire leaping from one house to another can cause great danger. Unfortunately, at the beginning of the crisis in the United States, we largely ignored it. We had very little federal or national policy saying do this or do that. Leadership tended to come from governors and from mayors. And even today, there's a feeling that within the United States and some of our states, people are talking about remodeling their kitchen when the house is on fire. Everything right now needs to stop as we as individual homeowners and as a neighborhood try and douse these flames.
Thank you. Thanks for carrying the metaphor all the way through. So what are the different factors that governments are having to balance as they navigate the crisis?
The biggest factor is, of course, economics, and many people are out of work. It was difficult enough for people to make their rent payments on April 1st. We will be in this conflagration at least for another couple of months, and another rent payment is due on May 1st. People are running out of supplies. What are they going to do economically to survive? Well, the national systems and the international monetary systems have said, we're just going to keep paying people, right? We need to dump more and more liquidity into the system, print more dollars, make more money available. That is a helpful short-term solution because it does pump money into the economies. It's not at all clear what's going to happen when things get better, because this is also a recipe for hyperinflation in a year or so. We haven't experimented with economics in this way before. This kind of massive infusion of capital. So that's a significant crisis. And in the short run, people have to eat and they have to find ways to stay calm and deal with their mental health and help each other as families. And if we're all focused on economics, we can look away from these other problems that happen within families and in communities as the stress levels are so high. So this is an amazing time and a great challenge, not just for governments, but for families and for communities and for businesses.
So this may be the trillion-dollar question. How, as a leader, do you balance economic health with personal health?
I think the first thing that our leaders have to do is be honest with the citizens that these are trade-offs, that you can allow the economy to go relatively well right now, as they're trying to do in Brazil, by saying, don't stay at home, keep the economy running. But there is absolutely a trade-off between gussying up your economy so you're in a more competitive position with your neighbors or on the international markets, and taking care of the health and well-being of the people at home. So anyone who says, well, we can do both at the same time, isn't being honest. There's going to be suffering for the economy, there will be suffering for people. And I think we need to be talking about trade-offs in general, right? Trade-offs between privacy, trade-offs between freedom of movement and inability to go anywhere. This kind of crisis just brings to the surface many, many conflicting values and trade-offs that are always present in public policy. But we ought to be much more honest and upfront about them now. We can't have a vibrant, moving economy and a healing society, a healing healthcare system. It can't happen. So how you balance those two is going to be fascinating to watch.
There's a lot of scary things that we've been discussing. And you've also referred to this as sort of an experiment, talking about the backlog that governments will have to deal with as things get moving again. I'm thinking about all of the different scientific things that are going to be revealed as a result of everybody staying home. All these different experiments are going on right now. And I'm curious what you think some of the positive outcomes of some of these experiments might be.
Certainly the world will look different a year from now than it did a year ago. And that's because of the year worth of so-called experiments we're going to be going through. Social distancing, working from home. I can't predict what's going to be a success or not, much less what's good or bad. But I think many of us are getting used to being able to work not at the office the whole time. Commuting will be very different. If we have just 10% fewer cars, for example, on the roads in Boston, Massachusetts, it would be revolutionary. And one can easily imagine 10% of the current economy going to working from home. We would expect, of course, there to be much better air quality in every major city around the world for this year, saving hundreds of thousands of lives. We would expect there to be real changes in how education works, maybe away from this walking through year after year, did you get this week done and that week done, to more of this distributed learning like you're doing here, where people can learn in smaller groups or at home and at their own pace. I think access to information about healthcare will change quite dramatically. Because first, the US government and other governments will want to have a much closer eye on what's happening at an individual level that might give them a hint that another pandemic is on the horizon. So access to and use of health medical records will presumably be changed forever. Um, is all of this going to be good or bad? I don't know, but it's going to be an exciting time to see how we as a society and how governments actually cope with this. So it will be fascinating to watch.
And it will. Are there any lessons that we can learn from history about how this might play out in an economic sense, in a geopolitical sense?
We tend not to remember hard times, and we often don't learn from those lessons. And for most of my life, which my life begins in the very early 1960s, I grew up thinking that there was just prosperity ahead for all Americans and things were going to work out great. And yet, even when I was born, I was surrounded by people who had lived through the trauma of World War I and the economic dislocations of the Great Depression and the horrors of World War II. And those were just barely in our rearview mirror. And now when we think about America or the world or, the clash of civilizations, it tends to be a rosy picture. But history can't be forgotten, shouldn't be forgotten. We need to always be aware that something like the great pandemic of 1918, 1919 was just 100 years ago, that we've had pandemics since then, that we've had world wars, multiple world wars in the last 100 or so years, and those are going to be coming again. So I think that it's wise for us to remember that history is real, tragedy is real, crisis is always just around the corner. And although our minds don't want to hold on to that as a possibility, we need to be prepared as individuals, and countries need to be prepared for worst case outcomes. So I hope this is a wake-up moment for us to pay much more attention to history. There's a wonderful book that came out more than 10 years ago, and it's called The Great Influenza. And it's by John Barry. It's about the 1918-1919 influenza. And in reading it, I've just been astonished how many parallels there are today to what was being experienced back then. Some communities tamping down very quickly to have social distancing, other cities and communities having parades to celebrate their own resilience, and yet the places that had parades to celebrate their own resilience had massive death tolls. The US federal government quite weak in their initial responses, and scientists not being listened to. Certainly that has been the pattern now in this pandemic now. I don't know why we don't learn very effectively from history, maybe because we try to avoid it and not read about it and not think that those kinds of problems are with us today. But there is something distinctive about those past traumas. They either bring nations and people together or divide them even further. There is a moment of real opportunity at the beginning of this kind of a trauma to bring the country or bring the nations together and say, we are all in this together. Will this trauma, this pandemic, bring us together? It remains to be seen, but if we look at history again, we go back to 1918 and 1919, that trauma and our poor response to it actually did bring the country back together again. World War I had certainly helped, but this trauma and how we reacted to it launched a massive change in US health policy, in communication, and it was seen as a fight that was a good fight. When we look back on it now, of course, we think, wow, look at how many 600,000 people in the United States died? That's outrageous. And yet, many, many, many more would have died if it hadn't been so successful in some of those local responses. I think my grandchildren will be remembering this and thinking about this as a pivotal moment in this country's life and their lives. I just hope that it's used to bring people together. And we have to wait and see, don't we?